Hi there, beautiful mamas. You're all welcome back to my YouTube channel. In today's video, we're going to be talking about what happens within the first few weeks after you've had your baby. So from after the first 72 hours to 8 weeks after you've had your baby, I'm going to be giving you a rundown of what happens, okay? If you've not watched my video about the first 72 hours, I'm going to put it up there. Number one, when does your milk come in? For me, my milk came in on the 6th day. Yes, on the 6th day after I had my baby. On average, most moms get their milk around the 3rd to the 5th day. Usually it's colostrum within the first, second, third days, and then the actual milk comes in. For me, I felt a rush coming into my breast and I really didn't understand what it was all about. I thought the milk would just flow. You wouldn't really feel anything, but I felt it was like a wave going through my breast. Yeah, so you can expect to feel something like that. So the second thing you need to know about what happens is, when do you take your first postpartum poop? Now, I know it sounds funny, but it's actually a thing, because in this period, you could be constipated. You don't want to you don't want to put any stress around that area because it's gone through a lot. You want it to be as smooth and easy as possible. Yes. So drink lots of water, eat a lot of fiber, and I'm sure you would be able to do your business without any troubles. The third point is postpartum sweating. This would sound weird and crazy, especially if you've never heard about it before or you didn't experience it. Yes, there's actually something called postpartum sweating. So what happens is that your body is trying to get rid of all those extra fluids that is accumulated when you are pregnant. And in doing so, it's making you sweat. So what you need to do to make this easier for you is have a towel handy or a handkerchief, anything, a clean cloth around that you could just use to dab yourself. Moving on to the fourth point, health checks. Within the first few days, you should expect a visit from your midwife or the health visitor. So they usually come around just to check on you, check on your baby, see how both of you are faring, if you're doing well. And in this period, they would also check for jaundice, how many wet nappies, fever, look at the environment you're in, if everything is okay for your baby. They could also schedule you to go see them at their clinic or at the hospital, wherever they are, so that they could also check up on you. And then there is another one within the 6 to 8 week period. Here in the UK, you need to call in. Usually, I had to call in when my baby reached 6 weeks because I was so eager. I called in earlier and they told me, no, I need to wait until my baby is 6 weeks. So immediately my baby was 6 weeks. I called in. I didn't even wait, and they said, okay, they're going to book me. What happens in the 6 to 8 week check is that your doctor is going to ask you several questions. If you're okay, your mood, how you're coping with baby. And if you have anything you want your doctor to know, now is the time to let them know, okay? Moving on to the fifth point, mood changes. So mamas, the postpartum period can really be a lot. Your body has gone through so much and it needs time to recover. However, a lot of moms do have what we call postpartum mood changes. Now, this could range from postpartum blues to postpartum depression, postpartum psychosis, OCD, which is obsessive compulsive disorder, anxiety, even a not so common one known as post-traumatic stress disorder. Yes, these things do happen, and I have a whole video I've made on it where I dive into it and I talk about it and all the help that you can get. So please, if you're interested in that, check out that video, okay? Don't forget to subscribe so that you don't miss out on any helpful information, okay? So if you're currently struggling or having any mood changes whatsoever, please do not hesitate to speak to your healthcare provider. Number two, call your friends. Let them know, okay? Let them know you need support. Let your family know. If you have people around you that you trust, let them assist you during this period. So the sixth point is body changes. Your postpartum body isn't what it was before you got pregnant. It can never ever be. Your body has seen a lot. So what are some changes that you can expect to see? Hair loss, you could start to lose your hair or even your hairline. skin changes. There's something called melasma. That's when your skin gets darker. And usually after birth, it resolves gradually over several months. But for some moms, it can even persist. It can take years for it to actually clear off. Okay. So see your dermatologist, that's the skin doctor. If you are experiencing something like this, your breast could get saggy. You could have urinary incontinence. That's when your wee just decides to come out when it likes. I mean, it could embarrass you outside. So if you're experiencing this is another reason for you to go see your doctor. There's also a very common one known as diastasis recti. This is when your tummy, the muscles of your tummy, they expand during pregnancy to accommodate your baby. But after you give birth to your baby, they become loose and they're not really able to come back together. In some people, they do come back together, but in most moms, they need some form of exercise. So you could see your physiotherapist or a certified gym instructor, or look up exercises online that you could actually do. So there's a way to check for diastasis recti. Okay, you want to lie with your back to the floor or on the chair, and then you bend your knees. Okay, so the next step you want to do is sit up gradually. Okay, don't sit up fully, just sit up halfway, and then using your fingers, you want to see how many fingers can enter into your umbilical area. Okay, that's your belly button area. Okay, mine was 4 fingers, so that's like a very major diastasis recti. So I had to start doing exercises online, and this really helped. My diastasis recti is currently, I think, 1.5 fingers right now. Yeah, though I've not really been as consistent as I should be. I'm sure if I was more consistent with the exercises, it should probably have been maybe half a finger by now. So it doesn't matter what body changes you are seeing. Okay, all you need to do is take it easy on yourself and give yourself years to fully recover. Yes, it actually takes years for your body to fully recover from pregnancy. Moving on to complications, it's really nothing to be scared of. All you need to do is just to be aware of these things and then try and be observant. So one of the complications is what we call deep vein thrombosis. This is when a clot, which is a lump of blood, forms in your calves, and then this could lead to leg swelling, pain, and this clot could actually dislodge and travel to your lungs. And when it gets to the lungs, it can cause difficulty in breathing, chest pain. It can even lead to death. There could also be postpartum hemorrhage. So there is the normal postpartum bleeding called lochia. I've made a whole video on that. Please do check that out if you're interested in that topic. However, if your bleeding is not following this schedule that I've given you, then that means there might be something wrong. So if you notice any of the symptoms that I've talked about, please don't hesitate to go to the hospital. The next thing you need to know is when your periods are going to start. If you are fully breastfeeding, your periods will most likely take several months to come back. But if you are mixing bottle feeding and breastfeeding, then most likely your period could even come back within the 5th to 6th week. So that was what happened to me. I had some lactation issues. If you've not watched that video, do check that out. Okay. But I was able to nurse my nipples back to being healthy, and my baby was able to latch on, and I continued breastfeeding. However, before I continued breastfeeding, I had to stop, and within that period I used formula to feed my baby. That could be why my period came in the 6th week, because I was shocked. I was surprised. Like, why would my period be coming in the 6th week? So you can expect your period within that time if you are mixing both of them. Even if it's just one day of formula feeding, there is a high possibility that because of that one day, your period could actually come back. Okay, because mine, I just did it for about 8 days, and that was what happened. Moving on to the next point. When are you likely to get pregnant? So mamas, this question is a very dicey one, but it's very important to know if you don't want to end up with 2 babies under the age of 2 or 3 babies under the age of 3. So you could get pregnant as early as in the 3rd week after you've had your baby. Yes, this might actually be surprising, especially if you're exclusively breastfeeding. But trust me, breastfeeding is not a contraceptive. I mean, that was what they used to teach us in those days, right? Yes, but science has proven, in fact, not just science, like babies, people that it has happened to, they have the evidence, the hardcore evidence that breastfeeding doesn't take care of pregnancy, doesn't prevent pregnancy. So if you don't want to get pregnant, it's best to talk to your healthcare professional so that they can prescribe an appropriate contraceptive for you. So the last point is a design that has been made for you to fully recover, or at least kickstart the recovery process after you've just had your baby. And this is called the 555 rule. So if you've not heard about this before, it means you need to spend 5 days in bed, 5 days on the bed, and 5 days around the bed. Okay. So within this 15-day period, it gives your body time to heal because you've gone through a lot. And if you have help around, trust me, this would really, really work for you. But if you don't have any help around, that's fine. Do what works for you. And always, always, always ask for help. Ask for help from trusted people. Okay, if you don't have any trusted person, then talk to your healthcare professional and they would most likely be able to assist you. Okay, you don't need to go through any challenging time alone. Okay, beautiful mamas, there you have it. These are the things you could expect during those first few weeks. If you have any questions, any comments, please drop them in the comment section below. And please, guys, like this video so that it can get to more moms out there. And subscribe, share, and turn on post notifications. Stay happy, stay healthy, stay safe, mamas. You'll see more of me in my next videos. Bye.